So good afternoon, everyone. So the following is a demonstration of skill validation of respiratory assessment. So first, you will need a stethoscope, and then always make sure that you wash your hands before entering the patient's room. So wash your hands, and then always provide privacy for your patient. So provide privacy. Okay. And then introduce yourself to your patient and explain what you will be doing. So good afternoon, sir. So I am your nurse for today. I am Nurse Naj, and I will be performing a respiratory assessment. Is that okay with you, sir?
Yes.
Okay. So first, you have to check the name and compare the name of the patient into the order sheet. So, sir, may I know your name, sir? Jamail, what is your last name, sir? Okay. So, always read the name of the patient repeatedly, and ask the patient to take their full name. So after that, instruct the patient to open their mouth so that you can assess their mucous membrane and moisture. So sir, can you take off your mask so that I can see your mouth and assess your mucous membrane and moisture? Okay, open your mouth, sir. After that, I will assess the patient's nail beds and capillary refill time. So, sir, can I see your nails, sir? Okay. So, it should be pink, and the capillary refill time is normal. So, note that the capillary refill time is the amount of time it takes for the nail bed to return to pink after compressed. So, after that, observe the resting and breathing pattern of the patient's chest. Observe the resting breathing pattern. Chest excursion should be rise and fall, whether equal, disequal, and fall, or unequal and shallow. Okay. Sir, can you take off your shirt so that I can assess your chest part, sir? Is it okay with you if I can touch the part of your body?
Yes.
Okay. So first, you should find the apex, which is located at the above the clavicle, and then after that, note that this is the right lung and this is the left lung, and note that the right lung has 3 lobes, which is the right upper lobe, right middle lobe, and right lower lobe. Unlike the left lung has 2 lobes, the left upper lung and the left lower lung. So after that, you will check here, and then in the this is the first part of the right upper lung and the left upper lung. This is the second intercostal space here, and then the third intercostal space here, and then the third intercostal space here. So you should always check the both sides of the lung so that you can compare if there is something abnormal in the right or the lower lung. So after that, we will proceed here to the fourth intercostal space here, and then after that, the mid-axillary. So here and here. So we will so let's get started to assess with stethoscope. So let's get started. So sir, every time I put the stethoscope in the part of your body, you should take a deep breath. Okay, sir? Slowly take a deep breath. Okay. And at the left. Okay, and then at the second intercostal space. And you should always compare third intercostal space, and in the fourth intercostal space, which is the still part of the left upper quadrant, left upper lobe, unlike the right is the right mid lobe. And in the mid axilla, here at the okay, so that would be the assessment of the interior respiratory assessment. We will assess the posterior respiratory assessment. So this would be the posterior. So we should we start here at the apex, which is this in the shoulder, above the shoulder, and then here from C7 to T3, and T3 to T10, down to T10. So this is our right. This is our right lung, and this is our left lung. So let's get started. Can you do this? Okay. Okay, so let's get started. Take a deep breath, sir. The mid axilla, down here. So, okay, sir, thank you. So that would be our respiratory assessment. That you should always make your patient comfortable after that, and then wash your hands and take notes your observation. So I observed that the mucous membrane is pink and moisture. The nail buds is also pink, and the capillary refill time is normal. And the breathing sounds also normal, and as also the breathing pattern. So that would be all. Thank you.